What we really need to understand is the work we do is not just for us, it's for the communities and the people we serve. And we need to continue to invest in those communities and the resources they need.
Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, joined by a really special guest today. We've been trying to get episodes that are kind of specific to the problems and questions that some of you are asking. So the theme of this episode is pretty targeted. It's expert executive project management techniques. And we brought on Mitchell Fong. Mitchell has so much experience. The LinkedIn resume is very long, but 15, 20 years of experience doing this kind of leadership and project management. And now he is doing kind of serial entrepreneurship in the consulting space, is what I like to call it, because you're working on so many different projects. Mitchell, if you don't mind just introducing yourself and telling us what you're working on.
Yeah, thank you. I really appreciate that background after years of experience on the health system side, on the innovation and digital health. Really wanted to pursue how do I continue that journey and help create equitable access to quality care for all, leveraging technology to innovate within healthcare. And so that's kind of what I've pursued that mission to do in consulting. And so I work on both sides, on both the vendor side as well as the provider side, looking at ways to kind of match make and evolve technology to truly drive value in a meaningful way for the providers, the patients, and the health systems that they serve. Because that was one of the largest gaps I saw with technology, was really the ability for great technology to be paired with sustainable processes that allow them to be adopted well.
Because it's like we have this technology that's really good and it works really well. And it might even work well and I was just talking to someone at Rush about this. It might even work well at a hospital. But when you try to expand it to your second, third, 18th, 20th hospital, it can be unsustainable and fall apart. And that's why we really wanted to bring you on, is because executives are handling these huge systems at this point. It's not just a single hospital that you're a CEO of. Now you got CEOs that are the executives over 40 hospitals and 100,000 employees, and that's why I wanted to bring you on. I wanted to ask the first question is about innovation under pressure, and that's because during COVID you were part of this really important team. Can you explain what that team did during COVID, and then also some of the lessons that you learned in terms of how to innovate and really get stuff done in a big way while under that kind of extreme pressure of COVID and everything that was going on?
Yeah, absolutely. Be happy to. And I love what you said earlier to kind of frame the question of the consolidation, the M&As really creating a different level of capacity and need for project management at an executive level. And so I commend you for that. And I think during COVID, we all were challenged with different processes, emergency timelines, but the need to really collaborate and figure out what is the need, evolving need with the change in regulations and the change in new information we learned about COVID so rapidly. Think all of those required a lot of project management techniques, but really the ability to be flexible and agile. So I'll start there. I think that's one of the biggest needs, is to always look at the project and understand at a high level, what are your goals? Are they shifting and changing? And how are you evolving with that? That comes with data, metrics, KPIs, but also understanding what your guardrails are to make sure that you're able to achieve the value propositions. But collaboration, I think, particularly in that setting during COVID, what we did was, as a community hospital in our area, we were able to secure federal funding and a lot of resources. So we actually collaborated not just as a system, but truly as a community with partners all over the state, all over the community, and federal funding partners as well, to convert a parking garage into a alternate care facility. We actually created 2 floors of it. We didn't ever have to use that many. But the bottom floor was a negative pressure unit. Really had to enclose the parking garage. That was an outdoor parking garage, and do a lot of things from an infrastructure perspective to allow technology to be used there effectively to treat patients. And so we essentially created an alternate care facility out of a parking lot within a 2-week time frame. Again, it was a large undertaking with many different stakeholders, but engaging each of them and having opportunities to align on the project status was extremely important, because we had to divide and conquer, and we had so many different areas of expertise there that needed to work synergistically to create the right infrastructure, that it was important. Things that I was particularly focused on during that transition was ensuring that we had the right technology and compatibility. So, did we have Wi-Fi in the parking garage enough to sustain all the devices? Did we have enough of the devices so we can do our virtual consults? We did use that as a COVID pre-discharge lounge for those patients that still required oxygen support, but were essentially relatively stable and getting near their discharge timeline. So we were able to use different technology there to centralize the monitoring and try to limit exposure for our staff as much as possible. And so that were some of the things that we were really focused on there. But we really wanted to take that as a step towards the future and what we wanted to do beyond then having a strategic plan that included evolution of technology there. And so that I will say was kind of the starting point, and out of necessity we took a lot of the principles we use, although at very different infrastructure downstream, to ensure that we didn't just rinse and wash away, but kind of think about how do we use this and then recycle it in a different way to repurpose it and help it grow.
Can I ask you a personal question about this? And this is a bit kind of off topic a little bit, but is there anything that you did to keep yourself um like on track during that time? Because I know that I work with about four different teams, sometimes three or four, and that can be challenging, right? But you're talking about dealing with way more than four different teams, and you're also dealing with a crisis situation, and you're also dealing with a political situation where at the time this had not happened in the United States for 100 years at this point. And so people were very going back and forth on the regulations and the laws, and you had state governments doing different things than the federal government. And then again, you're not necessarily building a new facility, you're retrofitting kind of the parking garage, and that brings its own policy challenges and safety challenges. Any advice on how an executive can keep their head straight during this time without getting pulled in different directions all the time?
Yeah, I think it's a great question, and it's definitely a challenge. Techniques that I used, one, I was very transparent and with communication. I think that's extremely important, top down and bottom up. I want to hear all the concerns, all the rumors that people are worried about that's trickling through the team so I can understand, address them if possible. But further, I also expected that from my leaders and the executives around the state and the community to share that same update on what's going on, what are the new regulations, and how have our protocols shifted or evolved because of those. So I think that constant communication, finding those venues, but also understanding and continuing to preach that it is an evolving situation that we don't have the answers to. I think being very vulnerable and honest was extremely important and helped me manage, but also helped gain the trust of the team so we can stay aligned on what the mission is. Early on, I think that we didn't do as great a job communicating as frequently and regularly, and that left a lot of gaps in what was being communicated. And unfortunately, that sometimes leads staff to jump to conclusions or hear rumors and start thinking about the worst thing that could happen, or that we don't know what we're doing when really, in this case, particularly with COVID, it was no one really understood. And we were learning as a globe, really, as a world together, what was going on. And so being very upfront about that, I think, was extremely important. And then just really trying to remove my emotional bias from it. I think a lot of times you put so much effort into project A, and then as the priority shifts and regulations change, and now project A is no longer the priority, it's kind of sometimes hard for people to be fully invested in that shift. I think removing your personal bias was extremely important because it was for the greater good. I know that I always looked at this. I'm not a military or a veteran at all. Commend all those that served. And I looked at this as my opportunity to serve our country and give back. And so for me, I kind of appreciated that almost emergency leadership style that was a very much top down, authoritative approach, because we kind of needed that structure at that time to really guide us on what is this process and change that we all need to align on. And if we weren't all aligned, it wouldn't have been successful. And it's the community that suffers. And so I think thinking from that lens and always communicating and putting the community at the forefront allowed us to really take a step back and think about how do we do what's best for the community and how do we focus on that communication, that message, and that action together.
Really important advice, because I know I enjoy when people are transparent, and I enjoy it, especially as you said, it's not just top down, it's also bottom up. I really need the people who are, working under my direction to really be very clear. It's very important that they're very clear on the feedback, even almost especially if it's negative feedback. because I am only a leader because we need someone to organize things, and I was the person to do it, right? And so, I think it's so important, and like you said, I really appreciate that on this kind of agile approach to where you're saying you weren't just kind of a one and done project. I like agile, but a lot of the listeners might be nervous hearing about that because they're going to say, how do I budget for an endless project? How do I, not, it sounds like I'd run into burnout where I'd be tired all the time, all these things. So, can you just explain a little bit more about this agile approach? Did you face issues with budgeting or burnout or confusion? And how did you define when one project started and when the next one begun, or ended?
Yeah, it's really great question because what you described is, I think, the unintended consequence of innovation sometimes. You want to do so much, and because as perfectionists, we always think, and this is the way I think, that whatever was perfect yesterday is out of date today. And we need to evolve it by tomorrow. And that's just kind of the way that I always think about process improvement and continuous process improvement. So I like to think of that agile process as the guiding principle for how I continue to evolve and innovate and ensure that the programs today truly meet the needs of today and hopefully for tomorrow. Um, Now, that being said, I think your question is really more on how do we frame this so that it's well adopted and how do we communicate it with the team so they understand where we're going with that. I think there were a lot of challenges there. Honestly, we learned through the process. I think the first iteration of we need to do project A and now it's evolving to A2. I think there was a lot of hesitancy, and to your exact point, some burnout, some frustration, some challenge, and it really took a deep conversation. We took a step back from planning. We had to ask the questions of what's our concerns, what's our burnout rate, what does everyone feel like today and what we're doing, and let me share why we need to do this. And I think when we were able to unpack that conversation, that helped us as leaders understand the communication, but also the plan and having to have outlines for what we're doing and why. As we evolved, we then also had to take a pause and ask our team, do we have capacity to evolve? Can we hit this timeline if we delay? If we don't, what's the consequence? And we really brought them into that planning process to really understand where we're coming from as administrators trying to represent the community. But additionally, it's not going to be successful if the boots on the ground and the teams aren't bought into that vision. And so it really tried to create that alignment. Um, as far as kind of shifting between projects, I think it really came with KPIs and metrics. That's a big way of how we kind of, I would say, I defined the project scope shifting is when we got new metrics or when we were looking at rolling it out to a new care location. That's a clear evolution of it. And we kind of put in the new parameters of the guardrails as well as our KPIs for our success metrics. And I think it really helped as we started also putting in the guardrails that allowed us to take a pause. I think that was the biggest concern in that exact instance that our staff had, where we had all these KPIs and principles. And at the early onset of COVID, it was just drive, 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 and try to hit your KPIs. What we started rolling out were also some KPIs that were guardrails to help us say, hey, we're pushing so hard. Are we pushing up against an unintended consequence? If so, let's pause and let's reevaluate what that unintended consequence is. And if there's a way we can either refresh what we're doing or update what we're doing and augment it to kind of address that. So hopefully that adds a little bit of color to that process.
So, kind of what you're saying is similar to how it's possible to overtreat patients. There's also that risk of that in business. I mean, I think like McDonald's doesn't need to offer a 5-star restaurant experience every time, and it's going to burn out the employees doing so, right? But it needs to offer a 5-star experience for what it is. How do you define that? Because in medicine and in healthcare, we always want to provide the absolute best for the patients. So how do you put a guardrail? I understand you can put a guardrail KPI for the bottom. That's easy, right?
Right.
But how do you put one for the top?
Yeah, I think it's a challenge, but you have to think about what you're trying to do. And um, I always look at what are some unintended consequences, and that's really hard to think about there. But when you're really looking at the top, I think you're looking at end goals, kind of your lagging metrics, so to speak. And so
Hmm.
at that point, I look at are there any leading metrics that might help us determine if we're not on track for that lagging metric? And I think that's kind of how we thought about developing guardrails, a precursor to what this outcome is, and other ways that we can quantify and measure that. So that's kind of what we did. What we did to kind of find that along the continuum is we really worked in those meetings with the large team on value stream mapping and
Mhm.
looking at the process where value is delivered, where maybe unintended consequences or risks might be occurring. And I think that helped us think about what are some of those metrics that we can use as guardrails along the entire process, leading all the way to the outcomes.
I mean, you know me, I'm a huge fan of values. I'm a huge fan of value chain in general. In Six Sigma, and this reminds me of this, is the course we just took at Jefferson through Villanova was a doctor's office, and he spent a lot of time with the patients, and they loved that. But because of the amount of time he was spending with the patients doing extracurricular things like filling out chart notes, etc., it was creating waiting room increases so that people were unhappy, and it was kind of this constant cycle, right? And so the issue was you needed to figure out a way to optimize the amount of time to spend with patients while also not reducing the amount of time so much that the patients were going to say, oh, he's only saw me for 5 minutes and charged me $100. So I appreciate that, and that's a real challenge for people to do, I think. But that value stream is so important because it asks, what do the people actually care about? What is actually adding value to this? You know, where is their losses in motion? Where is their inefficiencies? That's so important. Kind of one of the other questions I have for you is, why does how did Agile benefit you compared to standard kind of project management where you complete a project and then everyone never talks to each other again? How does this Agile approach work, right? Because you are working with so many different departments, and then, like I said, usually when these projects are over, I'm not going to be talking to, John in EVS, or, Marie in infection control again until there's another problem. But with
Yeah.
this Agile approach, there's a bit more contact. There's a bit kind of a continuation. What are the benefits of that? How did that benefit the organization?
Yeah, absolutely. And kind of tying to the last point you made, I think prioritizing customer value. And with that, generally we look at patients as the customer, but the beautiful part of this iterative development and agile is everyone is your customer, right? And so because of that, I had all these touch points with different departments and divisions to ensure we were made in contact. But further, we started to brainstorm on how we're delivering and driving value, efficiency, quality, but also looking at that burnout as a part of that, and culture. I think that allowed us to look at various different approaches to really improve our processes. And that was valuable because we were able to address culture at the root and communication with respect. I think things along those lines are ways that allowed us to collaborate at different levels, both up and down. And that creates a community where it's a safe place to share your honest thoughts and feedback. And that was a big part of that continuous improvement or your iterative development, however you want to frame it, is we're still continuing to solicit feedback, and people are willing to give that feedback because A, they don't think they'll be penalized. They can share their thoughts and they can voice their frustrations. It might even just make them feel better about what's going on. Uh, but then B, you create a forum that you can demonstrate you're taking the feedback and you're using it for continuous improvement. And I think that was a key part of it is we had continuous checkpoints and updates. And from those, we would select some of the issues that were brought back up as areas to whether explore or to make changes. And we would come back with recommendations or just research on where we are finding the gaps and allow us to brainstorm across different stakeholders to continue to iterate and improve. And I think that's what also led us to say, hey, let's take this. Even when we didn't need the parking garage as alternate care facility, we still have patients that are getting discharged with oxygen support and respiratory conditions. How can we evolve what we've done for a different population, but continue what we're doing and continue to evolve? And I think that's kind of how we saw that project continue to shift. And we brought in more respiratory therapists and all these other teams to be able to continue that vision. So I think that's how it really helped us look at ideation, but continuous process improvement and culture.
And now, from what I understand, it has turned into kind of a larger part of the organization in terms of remote care, the command center, and then that's grown into its own kind of thing in another area of the organization as well, right? It's kind of grown into multiple different verticals, and also provided a lot of lessons learned, right?
Absolutely. I think when we looked at innovation with technology, in itself was kind of novel for us. But then we were looking at centralizing the transfer center into doing something different, into what we called kind of the transfer center 2.0. Historically, we thought about transfer centers as where you take patients that need to come to you and you figure out how you can help place them. But patients are coming to you. And what we thought about is, hey, what we're doing during COVID is figuring out how do we bring care to you as patients or other communities that we support. And so we kind of elevated our vision for the transfer center to incorporate this virtual nursing, this virtual monitoring, some of these different programs that we've developed virtually to figure out how we can better serve our rural and transferring partners by delivering care to them and collaborating in that fashion. And I think that we saw a huge evolution in growth and the opportunity to collaborate across the community, but also provide better support and care to the patients in their home.
That is, and I like that. Again, going back to like Six Sigma, there's no rework and or not as much rework involved. You think about manufacturing terms, and you're not retooling the entire factory every single time health conditions change in your community, right? You're just trying to find ways to make it adjust. Really important. I want to leave you kind of with the last question. I really appreciate your time. We're heading into 2025. When this episode releases, it might actually be 2025, but we're in the final days, and so of 2024. And so I want to say, what assignment could you give me and members of our audience as executives on what strategies to try to employ for 2025? Because without giving us kind of an assignment or a dare to do it, we're going to forget about it. So what are your thoughts on like what things should we really absolutely try to employ this year? And we can make it as part of our New Year's resolutions.
That's a great question. Super open ended, too. I'll leave with one I think is always do good for your community and look at that from a population health lens. I think a lot of
Yeah.
times, particularly now, when we're looking at all the M&As and consolidation, bottom line is at the forefront for a lot of executives. And I understand that that's extremely important. But what we really need to understand is the work we do is not just for us, it's for the communities and the people we serve. And we need to continue to invest in those communities and the resources they need, look at our needs assessments and ensure that we're developing something to create that equitable access for all of those within our population that we serve, not just those with the commercial payers. But I really think that that's an extremely important part. And my challenge to everybody is just to do better today than you were yesterday. I think it's really easy to kind of sometimes forget to do better every day and get better. But I like to push everybody to continue that growth path and look at how you're making yourself better and how you're achieving your mission. So I'll say, look at the community, build for the community, focus on the community, but always look at how do I get better every day along that journey.
That is so important, Mitchell. Thank you for coming on and great advice. And we're going to have you on again next year to review how everyone has done over this past year or this future year in 2025. So I hope we can have you back on again and really appreciate your time.
Yeah, we'd love to come back on again, Cole. Thank you so much for having me, and I really appreciate the opportunity to share my thoughts.